Whenever you're ready.
Oh, okay, so we're recording as we speak.
Uh-huh.
Okay, well, my knee kind of gave out on me in September of '93. I didn't know what happened. I fell down in the street, and then I, got so anxious I actually caused myself to faint. But I was with Kaiser at the time, and they didn't know what was wrong. They didn't do an MRI. They sent me to physical therapy. My knee exploded like a basketball. I called the 49ers and I said, when your guys blow their knee out, who do they go to? And they didn't say Kevin Stone, but ultimately I found him. And, the doctors at Kaiser thought knee replacement. And of course Kevin said, we don't have to do that, you're too young. Yay. And it was aggressive surgery, I think. I was a smoker at the time, so my healing process was a little bit slower, I think, than it would have been otherwise now that I'm healthy. But so my swelling was worse, and I think my circulation and recovery was a little slower. But within 12 weeks after the procedure, I was back to totally able to do anything that I was able to do before. I was pain-free, I had no problem, and my knee never bothered me again. It's 17 years later. I'm fine. I'm amazed. A couple of years ago I fell and I thought I might have hurt my knee. It was swollen. So I came to see Kevin again, and it turned out that I actually kind of contused, I think he said, the other side of my knee. So like the good side, the uninjured side. But it was fine. I mean, that was a separate accident. Didn't do any damage to the graft. And I think you should do this. Before I would consider bionic body parts, I would do this again.
And if you could maybe talk about the name of the procedure and maybe what kind of activities you couldn't do before or you're able to do now that you like to do.
Okay, thanks. Well, it was the articular pace graft on the medial side of my left knee joint. And, as I said, my knee gave out and I couldn't do anything. I couldn't walk, I couldn't dance, I couldn't do anything. It was kind of over. And now, 17 years later, I do pretty much whatever I want. I don't run for recreation because I think it might, take my knee graft a little less, more time to wear out. But I do Zumba regularly, I do water aerobics, I swim, I play tennis when I want, and I'm fine. I have a healthy, active life.
Awesome. Perfect. Thank you so much.